Senator Heitkamp.
Thank you, Mr. Chairman. I want to welcome two great North Dakotans today. One whose footsteps I follow in my commitment to do better and to change outcomes. Senator Byron Dorgan and ahead of him, both Senator Kent Conrad and certainly Senator Quentin Burdick were champions for Indian people, champions for meeting the needs and doing what we must do to fulfill our obligations that we took a sacred vow when we signed treaties. And somehow every hearing we have, we see the failure of meeting those treaty obligations, the failure to do the right thing. And I want to welcome Mary Wakefield, who served as Senator Burdick's chief of staff and has a long history of trying to improve the quality of health care in rural areas and certainly the quality of health care in Native American communities. I want to just make, I think, what seems to me to be a very simple point here, because we come to these committee hearings all the time and we talk about the parade of horribles, and it's not just in healthcare, it's in housing, it's in education. We just make a long list, right? But yet, let me give you some numbers. The average Medicare spending per beneficiary, Medicare spending, is almost $12,000 a year. The average spending, national health means everybody, is about $8,000. The average spending in the vet system, $7,000. The average spending in Medicaid per enrollee is about $5,500, almost $5,600. And when we look at what we spend in Indian health, it is barely $3,000. Is anyone shocked that we're here? Is anyone shocked that we have these problems? We have to be serious about fixing this problem, and if we're serious about fixing this problem, we're going to be serious about funding the fix. No one should tolerate what we read in this report. No one thinks this is okay. You've got to do better with what you have, and you cannot accept a culture of failure, because we see it over and over again, whether it's BIA, whether it's Indian health, whether it is Indian education. We have accepted bad results. That's got to change. But Congress shares responsibility. Congress shares responsibility. The president shares responsibility. If we're serious about fixing this, we're serious about funding it. And so I just want to lay out some concerns that I have, and we need to know what it's going to take to fix it and how we're going to get the resources so we can. Thank you, Mr. Chairman. I have a couple quick questions. Mr. Slavic, when did CHS or CMS actually notify not just the hospitals, but the leadership of Indian Health and potentially the Secretary's office about these deficiencies?
And I'm going to ask my colleague to walk through a little more specifics on the timeline. But our process is, as soon as we're aware, we make the local representatives on the ground aware. In this particular case, Mr. McSwain and I spoke immediately upon the determination. I called him, and we had a very direct conversation.
Are we talking about immediately upon the determination of deficiency, or immediately upon the determination that you were no longer going to certify an IHS hospital?
We're talking both. In the case of the deficiencies, those are communicated as the reports are completed at the local level. In the case of my conversation with Mr. McSwain, that happened in the case when we were going to notify him that we were terminating.
I might suggest that in the future that you not leave it up to just notifying the local people at the hospital.
Yeah.
I mean, obviously, we had an information gap here where people who should have been responsible immediately for change were not notified. And that concerns me. Secretary Wakefield, Assistant Secretary Wakefield, Deputy, get it right, Mary. Deputy Secretary Wakefield, when did the Secretary's office become aware of the problems in these hospitals?
Senator Heitkamp, I will have to get back to you with an answer to that question. I'd be happy to do that. I'm sorry I couldn't speak to it specifically, and I know that's what you're asking for, is a specific date.
Because I think the point that I'm trying to make is that you all work under the same umbrella. And there's got to be, we can talk about miscommunication and talk about metrics, but you got to all be communicating with each other. The other point that I want to make is the extraordinary difficulty of serving a population with chronic disease, with a lot of history of trauma, a lot of history of challenges, both behavior and mental health. We see it in the substance abuse. We see it in high rates of suicide. We see it in chronic disease then being reflected from these conditions. I am a big believer, as a lot of people at SAMHSA, a lot of people who are working on this, that we can do better in terms of treating the whole person. So we continue to treat chronic disease and never really get to the problem. So I'm wondering what IHS is doing and what HHS is doing to begin to address things like trauma-informed treatment, begin to address merging this curative medicine model with behavior health and mental health models so that we can treat the whole patient. Deputy Secretary Wakefield?
So I would just say that the Secretary Burwell asked the administrator for Native Americans at the Administration for Children and Families to lead our HHS-wide effort on exactly this area, and that is to develop what would be a comprehensive, integrated, department-wide approach that stems from an understanding and the evidence base around historical trauma. So that is department-wide. That's underway, and we're looking forward to consulting closely with any member of this committee that is interested in tracking against that work as it pushes forward.
And that I hope that as we're looking at recruitment and retention, we're looking at recruiting a new kind of physician, whether, you know, more people who have actually received this type of training, because I think it's critical if we're going to have long-term better outcomes that we change the dynamic of how we deliver the service. You know, finally, I want to make the point that no one here should be happy with this outcome, and that my frustration always is that there is almost a culture of failure. What can we do? There's nothing we can do. And yes, we have an obligation to fund, but you have an obligation to come with a plan that changes outcomes. You have an obligation to tell us what you need. And my frustration always is this, you know, we're going to rearrange, and I'm not saying that's the response we're getting, but rearrange the deck chairs on the Titanic because it's going to go down anyway. Let's not have this hearing again in 5 years. Let's come back. Let's have constant communication about what we're doing, how we're changing outcomes, and make sure, whatever you do, that this is done in consultation with the tribes. Because the people who are most concerned about these outcomes are the tribal elders and the tribal leaders and the mothers and fathers and the people who see the horror of the lack of delivery of health care every day. Thank you, Mr. Chairman. Mr. Chairman, just one point. I almost got jealous listening to Senator Udall. You know why? Because we don't have any place for detox in North Dakota, a desperately needed service. And a tribal chairman in a recent visit with me told a story about tribal police being called. A woman high on methamphetamines coming down. They had no place to take her. So as they left, she walked to the church, sat on the steps of the church, and froze to death. So it's not just about the quality of care, it's access to care. And if we do not build access to detox, to substance abuse, rehabilitation, we will always fail. Those conditions add to and exacerbate chronic disease. We have record amounts of smoking. The highest rates of smoking in this country occur among Indian people. We know what that means in terms of diabetes. We know what that means in terms of chronic heart conditions. And so we not only need to look at how we do better with the services we provide, but we need to think about new services. And I asked Senator Barrasso if he had detox. I don't know if South Dakota has any detox, but let me tell you, this is a desperately needed service in the Great Plains region.